everyone, I am Prerna from Medwiki, and today we are going to talk on a very common health concern, that's diabetes. 1 in 4 individuals in India is suffering from diabetes, and today we have with us Dr. Rajiv Bhatia, an expert who is going to share his insights with us on this special concern called diabetes. Welcome, Dr. Bhatia.
Thank you for having me.
So basically we had posted a few questions around, and we have tried to sort of collect the normal questions that people keep asking about diabetes. So we had a list of few questions. We would like to thank our viewers for sending us so many questions, and we would like to have Dr. Rajiv Bhatia focusing on those questions and sharing his insights and clearing your queries today. Hello, Dr. Bhatia.
Yes.
Would you please like to introduce yourself to our audience?
I'm an internal medicine physician and also trained in public health. I've worked in the San Francisco area for about 40 years in medicine. Right now, I take care of patients at the VA hospital in Palo Alto, and I train medical residents at Stanford University.
That's great. So, of course, this is going to be a great one because we have an expert who has a global experience. So, let's begin with this, Dr. Bhatia. So, out of all the concerns that we could collect from our audience, the first one, because we just discussed that every 1 in 4 individual is suffering from diabetes. So, the family around is always concerned about it, what will happen to me. So, if we say that, if any one of my family member or my parents are suffering from diabetes, so what are the chances that I will be suffering from diabetes in your future?
Well, we can't predict that with a number. It's higher than if you didn't have any family members with diabetes, certainly. But we need to understand diabetes is not inevitable, even if you do have a family history. Diabetes has many different risk factors or causes. Those causes are genetic, the causes are in the environment, the causes are in our behaviors, how we eat, and how much we exercise. So it's all of that acting over time, but it's not inevitable. You have to understand that when you say a family member has diabetes, we share more than genetics with our family members. We share eating behaviors, we share diets, we share activity patterns. So it might be that when we are seeing more correlation in diabetes between family members, it's not all genetic, but it has to do with the correlation or the similar behaviors and environments and diets between the people. But diabetes is not inevitable, and there's many things that a person with family members with diabetes who are worried about diabetes can do to make sure that they never developed diabetes in their lifetime.
So can we say that having a different lifestyle from what my parents had can prevent me from having diabetes?
I don't think it has. I think it's an interesting question. Remember that diabetes wasn't so prevalent in India. This has only happened in the recent in the recent decades with more easy access to food. Right? And more sedentary lifestyles. These are environmental and behavioral changes that have happened over the past decades. Your parents' had less diabetes. Your parents have more diabetes, and now I think it's up to this generation to be proactive and think about what they can, why is this, and what they can do in their lives and in their environment to prevent it happening, not only to them, but in society at large.
So I think we clearly know that the sedentary lifestyle that we all are going towards these days is causing more of a trouble to us.
That's one thing. So let's break it apart and look at the big picture. Diabetes is at its root your body unable to process carbohydrates. Carbohydrates is a type of is one class of food. So does everybody know what carbohydrates are? Does your audience know when we talk about carbohydrates, what foods contain carbohydrates, which carbohydrates are good and which carbohydrates are bad? Is that something?
No, I think we should definitely clarify.
Okay. So again, diabetes. If we think about what's happening in diabetes, the body isn't able to regulate the molecule glucose in the bloodstream. Glucose is essential. It is the fuel. It is the gasoline it's the energy source in the body. The body needs enough, but not too much. If there's not enough, the body doesn't function. The brain shuts down. If there's too much, there's damage to the internal organs of the body. So the body is constantly regulating this. People might not know that your body is producing glucose all the time. It's breaking down, it's storing glucose, and it's breaking down tissue to produce glucose when it's needed. At the same time, the body is pushing glucose that's extra from the bloodstream into the tissues to store it. And that kind of balance is happening all the time. We eat food, and food with carbohydrates is broken down into sugar. So food with carbohydrates includes pretty much all plant products, okay? But some, like grains and root vegetables like potatoes, but some carbohydrates are very complex, and the body has a hard time to break them down. It takes time, and so the time that the body takes to go from food to glucose is long enough that the glucose doesn't rise very quickly, and the body can process it slowly and store it as needed. So lentils, legumes are an example of a complex carbohydrate that the body takes time to digest and is not as aggravating or causative of diabetes. On the other hand, when we think of processed rice, white rice, body very quickly turns that into sugar, and the sugar levels rise very quickly and overwhelms the ability of the body to manage the glucose level. So if diabetes is unbalanced or high glucose levels, the body isn't able to process that sugar fast enough. The diet changes we need to be thinking about are changing the type of carbohydrates, moving from highly processed carbohydrates and starchy vegetables like corn and potatoes to more complex carbohydrates that are hard to break down, like non-starchy vegetables and legumes and lentils. And that's just the diet. That's just the diet piece. And so we think about, and we can also think about exercise in diabetes. So what is happening in exercise is the body is consuming glucose during exercise. So that's bringing the sugar levels down. The body is also maintaining muscles when you exercise. And muscles act like a sponge or a storage unit in the body for glucose. The more muscles you have, the more the body can store or put away extra glucose. It helps the body regulate and keep under control the amount of glucose in the system. So if we think about these, sort of diet factors, we have to think the diet is controlled also by our culture, right? Our habits and the environment. What's happened in the Indian diet over the past several decades, where we have seen diabetes levels rise? What have you observed change in the past several decades?
Yeah, I think it's increasing almost sevenfold in the next 5 years. So it has grown up risen up quite.
But what have you observed to change in the Indian diet?
In the Indian diet, I think that we have been eating the old traditional food, plus we have added on junk and those cheese and all those factors. So it's a mixed thing that we have been going forward to. And that old Indian tradition of having those puris and parathas and pakoras is still there. Okay. So I think it's a very unbalanced way of having that.
I've looked at some statistics, and I come and I've visited India throughout my lifetime, and what is memorable to me about the diet is that when I come here, I eat mostly vegetables. And I'm not talking about eating aloo and parantha. I'm eating vegetables in my family much more than I do in in the U.S. When you look, I find it that the fruit and vegetable consumption in India is very low, and there's a lot of people here. Growing fruits and vegetables takes land, and they're expensive. Most people can't afford a diet that is rich in fruits and vegetables, and that has enough fruits and vegetables. So that's another factor that's happened. And we've seen a proliferation of cheap, high energy, highly processed carbohydrates. The Haldiram namkeens. I'm not supposed to say any brand names, but all the namkeen that comes in bags that just you stick your hand in and you put it in your mouth.
And you can't stop yourself from
it's designed to be addictive, right? Yeah. So, and decades ago, what humans did was they had to work for their food. They had to walk for their food. They had to exercise for their food. We were farmers. We built our own homes, right? We didn't have all of these things delivered, all the food delivered to our, door with one of these, bicycle delivery, motorcycle delivery people, right? So that work for the food balanced our intake. Now our energy needs have dropped, and our food access has grown, and our brains are fundamentally designed. Humans are designed to eat food when they can find it, right? So we just keep putting food in our mouths, and those are some of the factors that are happening, and they require being very consciously sort of changing your behaviors. But if the entire culture is living in some way, right, it's hard as an individual to sort of go against that culture too.
So I think I would just like to connect with something which I have heard earlier also, that you were just saying that we have to find our food. Now we eat our food according to the timings, like it's 8 o'clock, let's have the breakfast, have some snack in between. Earlier it used to be like, you have to find it, so you might even take a gap of 4 or 5 hours because you didn't get the time or the access to the food. And that time, I think that also matters, because now we are having it in the time frame of having a breakfast, snack, lunch. So maybe the access, the availability, everything is much more than it was earlier.
The routines, right? The routines. So if we understand this, and people can understand it, even if you understand that this is what you need to do to prevent developing diabetes, we need to change our diets and be more active. How do you do it, right? And it's not magic, right, to limit these bad carbohydrates, these fastly metabolized carbohydrates, but it's incredibly hard to do. And when something's hard, we have to think like, what's motivating them? What's motivating you? You see your mother and father with diabetes, and that's a motivator. You see them, even if they're not suffering, that they're doing their insulin shots, or they're worried, or they're taking all of these medicines to prevent diabetic complications. She goes, I don't want that for my life. So that can be motivating, right? But again, humans don't have a difficult time valuing a future problem. When your sugar's high,
you'll see it when it will come.
When your sugar's high, does it feel bad? No. We have, I have patients who have had sugars in the 200s, 300s, uncontrolled diabetes for decades. And they just say, look, I'm tired of working. I'm tired of it. It doesn't feel bad. It's, they've given this sort of, it's been too hard. They've given up. But because there's nothing immediate, right? And then I've seen those same patients, they've had a heart attack, or they've had an amputation, or something, serious has happened, and then they say, oh my God, now I want to control the diabetes, but then it's too late. That high sugar has been running in the bloodstream, causing damage for years and years, and And now controlling your sugar doesn't really matter. You've already done the damage. So this issue of motivating, self-motivation, because you can't, is a very important problem to solve. It would be better if it was solved environmentally. If one of the things I tell my patients with diabetes, one of the first rules is you do housekeeping in your pantry, in your kitchen. Meaning that if there's any food that you can stick your hand in and put in your mouth, you should get rid of and you shouldn't buy. A simple rule, right? And I tell patients once a week you go out and have a treat, but those treats are not stored in your cabinets and cupboards, right? Where they're easily accessible. Once a week you go out to a sweet shop, fine, have a good time. So that's a simple rule, right? You don't go to the store, at the grocery store, and buy the napkin. And then, it's like, I can imagine having these conversations with my wife, and, we do have these conversations. We actually argue, and she likes namkeen, and she says, oh, it's important because we have guests come over. We have to serve them, we have to serve them something. It's like, so this is culture, right? It's not an easy, and she's right? She's not wrong. But these are the kinds of challenges that we have to think about doing. Now, if it's a group, right, the culture says, you know what, we understand this now, and I don't want me and my friends and I to have diabetes. We're going to have a rule. Rule is, don't serve me namkeen when we have social events, right? Like there's, that's a way, that's something that people do because humans need mutual support. They need that kind of reinforcement, particularly when there's this very sort of difficult sort of cultural change.
Yeah, I think we make it a point that we will not keep in our pantry, as you said. But then having it outside in a social party or in a gathering is like, having access to it and you are really tempting to eat it. So to stop yourself there becomes more difficult rather than getting it at home.
Now, we started this conversation about talking about will I get diabetes? And I'm saying it's impossible to predict if your family members have diabetes. If you see yourself start to gain weight, if your blood pressure starts to go up, those are indicators that you are heading towards this metabolic disturbance and diabetes. So it's also important to catch this early, and that's why we have this term prediabetes. The diabetes is diagnosed when the average blood sugar level is over a certain level. Okay?
So when you say it's above a certain level, so what are the numbers that we give?
Yeah, there's a couple of ways you diagnose diabetes. One way is using a test called the hemoglobin A1C. It's a blood test, and it measures what it is. It measures how much sugar is attached to your blood molecules. And by seeing how much sugar is attached to the blood, we can tell you what is the average blood sugar over the past 3 months. And if that A1C level is above 6.5, we diagnose diabetes. Okay. Diabetes can also be diagnosed if the blood sugar, the random blood sugars, are consistently over 200. Okay. It can also be diagnosed with an abnormal glucose tolerance test, which is a test where you ingest a certain amount of sugar and check your sugars sort of afterwards. Now, this average sugar is not. It's not one day that suddenly you will cross this magic line and become diabetic. Your average sugar is going to be creeping up, and when your average sugar creeps up, it's telling you your body is having a hard time getting the sugar out of the bloodstream and storing it, right? Or it's having a hard time processing the amount of sugars and carbohydrates that you're eating. So we recommend getting screened for diabetes. If you had a family history of diabetes, if your weight is above normal weight, it's important even in your 20s to start getting screening with, for example, a hemoglobin A1C test. And if it's normal, you should check it again in 3 to 5 years and watch how it's changing. If it's staying the same, you can feel comfortable, right? If it starts to trend upward, right? Even if it's not getting into the pre-diabetic range or the diabetic range, it's important to say, oh, I'm heading there. I need to start reducing the amount of carbohydrates. I need to make sure I'm exercising. So monitoring this early is a very, very important practical step and a motivating step. If you see your average blood sugar creeping up from the normal level, which is considered below 5.7 for the A1C, and up to 6, which is between 5.7 and 6.5 is considered pre-diabetic, or heading towards diabetes. You see in that range, that's a warning sign for you. So you gave a statistic, 1 in 4, about 11% of Indians are thought to have diabetes, and another 15% have pre-diabetes. They're heading sort of in that direction. And that's a point where people can start to act and try to reverse it and bring that average blood sugar down. And it's completely, it's doable. It's I guess theoretically doable, or it's completely doable. It's just hard to do.
So, like you just said that maybe we can say that every adult should get tested.
Every adult should get tested. Every adult should get tested once before age 30. And
what about kids? Do you recommend it in below 18 years, like sometimes, or there is symptoms that we can catch and get it tested?
Well, that's another. So we've been talking about screening simply based on worry or concern or catching this process early. So I'm going to break it down for children. If children don't have any symptoms, you might test them if they're obese, because we're seeing more adult onset diabetes, this type 2 diabetes, happen in the teenage years. Then for people who are not having any symptoms, then maybe screening once in their 20s, and then every 3 to 5 years to watch the trends would be the appropriate appropriate go. It's interesting. There's I think people very interested, very engaged in their health and getting comprehensive blood panels every year. That's probably not necessary in this age group. But if you have symptoms of diabetes, and symptoms of the sort of classic symptoms of diabetes are urinating a lot. You're urinating a lot because your body is trying to get rid of that extra sugar by urinating it out. Because you're urinating a lot, you're getting hydrated, and you're getting thirsty, and you're drinking a lot. So people who, if I have a patient not obese and says I'm suddenly started urinating a lot and drinking a lot, it's a high chance that they've developed diabetes. In India, we see also, and also in other countries, thin diabetes. So we've associated diabetes with overweight and being obese. When you're obese, think about obesity as your body has been storing energy in fat cells, right? And there's no more place to store energy. And so the body becomes resistant to trying to shove more energy or glucose into your cells. And it builds up, therefore it sort of stays in the bloodstream, and we diagnose diabetes. But there are people who are not obese, who also have diabetes. It shows us that diabetes is happening because of multiple mechanisms, not just being overweight or overeating. There's a number of very interesting studies that show that when a mother is malnourished during her pregnancy, those children have a much higher risk factor of risk of developing diabetes. And the thing, it's not well worked out, is that the organs, the pancreas and the other organs that are responsible for controlling sugar, were poorly developed in children in utero when that child was developing. And maternal malnutrition is a big problem in India. It's probably one of the factors why you see diabetes in populations that are otherwise, thin and poor, and in sort of villages, not your typical, what your stereotypical adult diabetic. Are we answering the question?
Yeah. So talking a little more about children, like the trend that we have been seeing with Indian parents right now is that we try to avoid giving them sugar, during the first year of life. Then we avoid some processed foods for some few years. All of us know that if we can prevent our child for 5, 7, 10 years, then they are not going to listen to us anymore. So is this early days of stopping them from having a lot of sugar, processed food, can this help in the long term that they might not eat too much? Like over the time we have been seeing is that if you do not introduce sugar till the first year of life, the child will not have that craving of having sugar in the future. So, is there any?
Yeah, I don't know if there's any science behind that. Right? I'm not aware of any good science behind that. I think this is something you may want to talk to, like a psychologist or somebody who's working. I don't feel like it's my sort of expertise area, but what I'd say here is that you want to model good eating behaviors. Children ultimately, whatever they do in their development, they return to behaviors that they were taught or modeled. And modeling behavior is more important than trying to control behavior. Like, my diet is very close to the diet of my mother and father. And my mom always cooked home-cooked, Indian food, and that's what I cook 90% of the time, right? I don't have, I have sweets occasionally, but I'm not addicted. No one restricted sweets. My mother was a pediatrician. She never restricted sweets. It just wasn't served day to day. Back to this kind of, pantry rule, right? Don't keep whatever you're going to tell your child to do, you have to do yourself. Right? Right? You have to be the role model. I think if there is severe deprivation, whether it's at the sweets or television, children will kind of, then crave those things that they've been denied, that they see their friends sort of have. Have wholesome meals at home. I think just have wholesome meals at home. Another role, I think, for parents is don't, cow, but it's like this, that it's a very pervasive signals for the child to kind of overeat. Children know when their stomach's full. So I think that allowing that to happen, that habit of stopping eating when their stomach's full, leaving the table, right, is a good idea. You don't want them to have empty calories like the sodas, but that means don't bring that in your house. And ultimately the adults are responsible, right? Don't bring it in your house.
I think I'm completely relating it to the point, because here what we think is that as a mother, I know that you should eat this much, rather than letting to be on the child that I don't want to eat more. And the tradition of complete your meal, don't leave anything on the plate, forcing the child to finish it off. So this is going to be very helpful to our viewers also, especially to all the mothers, to focus on the child's fulfilling.
Child will self-regulate. When they're not hungry, right? They when they're full, they should not eat. When they're hungry, they will eat. They might skip a few meals. Maybe they have an upset stomach. So let it happen. They'll come back to the table and they say, give me some food.
So, moving ahead, Dr. Bhatia, we have seen that I have seen.
I don't see you going through your cards.
No, I am. So, I've seen, even in my family, they've seen it, once you went and you get tested for diabetes and you have been diagnosed diabetic. So, there's a scenario like, you start crying because even if you're 25 or 30 years of age, you are diabetic. So, is that really seen that once diagnosed with diabetes, your entire life changes? You are not like a normal person like you were before? Is it something like that?
No, there's no reason why you can't live a completely normal and healthy life once you've been diagnosed with diabetes. There's no reason why your life can't be better or healthier once you've been diagnosed with diabetes. Because it's you have a predisposition, you have a condition that tells you can't eat as much carbohydrates as another person. If you eat more of these carbohydrates, your sugars will rise, and you'll either have to take medicines to control them, or if you keep eating and the medicines don't work, you may have complications. But if you say, well, I'm going to limit the simple carbohydrates, these ones that get broken down into sugar very quickly, right? I'm going to limit them, I'm going to change my diet, and I'm going to be more active. You don't even need medicines. I have my sister-in-law at the age of 55 who was diagnosed with diabetes. Her diet became she had incredible willpower, right? And she limited all of these more simple carbohydrates in her diet. And things are well controlled, and she's fitter than she's ever been. So yeah, it can be a wake-up call to have a sort of a healthy life. It's not that it's not easy. Particularly, it's not easy. You have, as we said, all of these cultural factors, the environment, to sort of contend with, but it's doable.
So one more term, like I'm trying to relate it to your conversation, is that we have been listening about reverse diabetes. So is it something that I have been diagnosed with diabetes, but if I lose certain things, I'll be back to my body thing?
So again, when you get diagnosed with diabetes, you're being diagnosed with a physiological condition. That means you are not able, that you eat this much carbohydrates. The average person will break that into sugar and store it, and their sugars will not be elevated. But if you eat the same thing they eat, like dal chow, the same amount, okay, you won't process it as well, okay, and your sugars will stay elevated, okay. Now that won't change. That won't change a lot. You could increase your muscle mass and have more of a storage, more storage units for sugar. You could be more active and exercise and burn off that sugar more. And I'm talking about in the scenario without medicines. And you can, if you change your diet to avoid these particular carbohydrates and have more of a very low carbohydrate diet, the diabetes will go, the high glucose will go away. So the predisposition to a high glucose won't go away, but it won't manifest as high glucose because you've avoided the stimulus, which is the high carbohydrate meals.
So I think we can say that reverse diabetes is actually about managing it at a certain level so that we don't have to enter into the insulin.
We call it diet controlled diabetes. Yeah, that would be well controlled diabetes, or glycemic, the sugar controlled without medicines. You have many people, not many, but maybe maybe 10 or 20% of my patients at the VA are able to control their diabetes with diagnosis.
So I'm sure your experience and knowledge was of much value to our audience. So I would like to just have a few questions of rapid fire round with you, which is just as a key messages to our viewers. So let's go ahead with that. So the first is, can diabetes cause fatigue?
Diabetes, when you have a high sugar, again, we talked about the body having to urinate right out the sugar, which can cause dehydration. So high sugars, poorly controlled diabetes, can often cause a feeling of fatigue because of the dehydration. That would be the most common sort of pathway. Usually the body tolerates diabetic level sugars without feeling poorly. Until it gets to this very high level where you start to get dehydrated.
So we have been talking about exercises. So is it safe to have exercise daily in case of diabetes also?
Absolutely. Right. And, there's no limit to the amount of exercise you can do for diabetes. I think it's important to balance what we call cardio exercises or aerobic exercises, walking, running, hiking, with strength build, resistance exercises where we are building and maintaining muscle mass. Because it's the muscle mass, the aerobic exercises will utilize or burn off the sugars. The strength or resistance exercises will build up the muscle mass, which will be this storage unit for the sugars.
So there's one more question around there always. It is about the fruits. So can diabetics have fruits? Is it safe for them?
Diabetics can eat anything. Everything is about moderation. Okay. As a rule, 1 or 2 pieces of fruit a day, right? But these are we have trade-offs. I have a family history of diabetes. I have my average blood sugar is well controlled. I try on most days to do this. That half of my plate is vegetables, not always, right? But non-starchy vegetables. About 20% or a quarter of the plate might be protein, either meat, right? About the same is some kind of grain. It might be rice, but more, dal. And then I'll have a few pieces of fruit every day. Now, it's a trade-off. I can't do without your white rice. Maybe you have to do without the fruit. If you like a glass of red wine, maybe you only have 1 piece of fruit. You have to balance this. Yeah. But there's no food that is. Even a sweet dish once a week should be considered okay if on a daily basis you're able to sort of follow the rules.
And we've been listening a lot that diabetes has a direct connection to kidney problems. So
yeah.
True. Okay.
Yeah. So we've talked about when when sugars are running high and the body isn't able to put or store them away and get them out of the bloodstream, they act as toxins. They result in more inflammation in the blood system, in our blood vessels. Every organ has blood vessels, right? The kidney has blood vessels, the brain has blood vessels, the heart has blood vessels, and it's damage to the blood vessels that is the main complication, the main route to diabetic complications. So damage to the blood vessels in the kidney cause diabetic kidney damage. The damage to the blood vessels in the brain explain why diabetics have more strokes. Damage to the blood vessels in the arteries to the heart explain why diabetics have such a high risk of heart attacks. Damage to the blood vessels in the legs explain why diabetics have foot ulcers. Diabetics, damage to small vessels throughout the body is the reason diabetics have nerve damage. Okay? It's all related to damage to blood vessels from high sugars.
Also, there's one more thing that we would like to know is that in case of diabetic people, it is more often seen that if they are bleeding, it is difficult to stop their bleeding than in normal people. Is that somewhere true, or it's just?
I am not aware that would be true. Yeah, diabetics maybe they have heart disease, and some of the medicines used to prevent heart attacks in people with heart disease, like you need people who have had a heart attack, they're on aspirin, and so they would bleed more. But otherwise, diabetes doesn't affect the clotting system.
Okay. And so the last one here, rapid fire round. So is insulin the only treatment for diabetes?
Oh no. Insulin is the body's is a natural hormone produced by the body that sends the signal that your blood sugar, the sugar levels in the bloodstream are high. Store it in the body, store it in the cells, in the tissues. So it's a messenger. Okay, it's produced by the pancreas. When in diabetes, the sugar levels are rising and the amount of insulin that's produced naturally is not sufficient to get it into the, to put that sugar back in the cells. So adding extra insulin can be another kick, right? There's also drugs, like one of the first diabetic drug was in the class called sulfonylureas. Glipizide, glimepiride are all examples of that. Those drugs basically turn on the pancreas, turn up the volume on the pancreas, cause the pancreas to make more insulin, produce more insulin. And insulin is signal saying, hey, sugar, go into the cells in the tissue. There is the drug metformin. In fact, when the first drug that anyone with diabetes should have, if they are not able to control diabetes with their diet and exercise, is metformin. It should be metformin alone. Metformin is a drug that helps the body better absorb the sugar and reduces the production of sugar by the body's tissues. It also is protective of the heart. There have been a number of new oral agents in addition to these two traditional agents, metformin and the sulfonylureas, that have emerged in the past 10 and 20 years that pretty much allow most people to avoid insulin therapy. Nevertheless, at some point, the pancreas for people with diabetes is overworking. And in some people, the pancreas tires out. And you can't stimulate it enough to get enough insulin. Some extra insulin is required. But most people who are on insulin are simply those who have been unable to control their diets and unable to lose weight. Lose 10% of your weight, and probably you won't need your amount of insulin.
Once you've started to the insulin, you can even come back. You don't need to.
Absolutely, yeah. You can control your diet and lose weight. It's an important point is that some drugs stimulate your appetite and therefore stimulate weight. So the sulfonylureas, the glipizide, glimepiride, they're causing insulin to be produced all the time, extra insulin. And so the body, and so in between meals, that your body is pushing the sugar, the insulin, and the sugar back into the tissue, and your sugar levels are falling. And then you say, oh, I'm hungry. And that hunger is in part because you're on that glipizide. Insulin is causing will make you feel hungry. So people who are on those insulin gain weight because of the drugs, because it's pushing the appetite up. So it's it's really a negative spiral. And you want, I work to get people off the insulin and off the sulfonylureas, losing weight. We have these new sort of miracle drugs coming out for weight, and they'll be available in India, I think, coming up in 2025. Unfortunately, very expensive so far.
I would like you to just share one key message to our viewers who already have diabetes. Only one which can just help them manage everything.
Okay. Understand diabetes as carbohydrate intolerance. The less carbohydrates you eat, the less you will need medicines, insulin, or otherwise to control your diabetes. It is completely reversible.
So, thank you, Dr. Bhatia. This was a really a learning session. I'm sure our viewers will get a lot of information out of this and will be able to prevent themselves from getting diabetic or manage their diabetes if they're already there.
Sounds good. Thank you for having me.